Welcome back to Langford Academy's nursing stream. My name is Hannah Mackenzie and I'm a theatre nurse at Langford Referral Hospital. In part one, we discussed the key differences between general practice and referral practice. So if you haven't seen that video, feel free to go back and watch that now. In this part, I will be covering sharpening your skill set for referral care. So, sharpening your skill set for referral care. There are many skills, our day one skills as a nurse that we train to do and train to become confident and competent within. Sharpening your skill set for referral care means that you will be developing and engaging with a lot more skills and developing within your career. You might learn new skills, and you may develop skills that already exist. So, transitioning to referral practice brings with it a new range of challenges and opportunities to develop in your career. Obviously, you will not be expected to know everything. However, trying to be proactive in researching and familiarising yourself with anything more advanced can help you hit the ground running. So, many skills are used every day and many skills are developed. These include intensive monitoring, client communication, team collaboration, clinical decision making, your adaptability, professional development / continued education, leadership and mentoring, advanced medical knowledge, advanced anaesthesia and pain management, clinical skills, diagnostic techniques, surgical support, wound management, and critical care and emergency response. Obviously, this is not an exhaustive list, it is a long list, but there are many skills that I've probably forgotten. So, advanced medical knowledge, specialised veterinary care. You obviously will need a deeper understanding of various medical conditions. These also include not common conditions. You will definitely be exposed to a lot more medical concerns of patients, and a lot of the time it is comorbidities. So it's not very often that you will get a dog which has got vomiting and diarrhea without there being something else underlying, because if it's just vomiting and diarrhea, a lot of the time that would resolve within general practice through their care. So again, various surgeries and treatments, especially in specialised areas such as orthopaedics, neurology, cardiology and internal medicine. You'll be nursing patients with complex needs and uncommon diagnoses. Also, like I said, nursing with comorbidities and using medical drugs that you may not have come across previously. So again, anaesthesia and pain management. We're very lucky here in the fact that we have senior anaesthetists who work alongside our anaesthesia nurses to gain a better understanding of how to obviously have a smooth anaesthetic and also manage the analgesia side. And there is quite a good collaboration between those two roles. So obviously, you will need to be proficient in monitoring anaesthesia and providing pain relief for animals undergoing complex surgeries and treatments, obviously under the senior anaesthetist's direction, but a lot of the time you are able to have a conversation with the anaesthetist and discuss what you feel would be a suitable plan. And if they agree with you, a lot of the time they will allow you to do that. Assessing and intervening with additional anaesthetic support. This includes obviously placing arc lines, performing and assisting in blocks such as epidurals, nerve blocks, joint blocks. You may be monitoring more complex cases such as cardiology cases for diagnostic imaging, surgeries, and using and discussing the use of additional drugs for anaesthesia and analgesia. So diagnostic techniques, as stated in my previous part, you will have to have some competence in using advanced diagnostic equipment So a lot of the time with doing x-rays here or radiographs, it is the imaging team's job to deal with that. So that might be the imaging nurse, or it might be the radiologist who will be given a list of x-rays to do, possibly by the surgery team or by medicine. They will then complete those, send them over to the relevant team, and then deal with that. Ultrasound, MRI and CT scans, as well as possibly fluoroscopy. Performing lab work, such as blood tests, urinalysis and cytology. Blood tests such as doing blood gases and knowing how to perform that using the machines and be able to flag to the veterinary surgeons those results. And then confidence in supporting patients through diagnostic procedures such as bronchoscopies or endoscopes, knowing how to nurse those patients during and after those procedures. Moving on to my area of interest, surgical support. So as I stated previously, I'm a theatre nurse. So assisting in surgery, so experience in assisting with surgeries, sterile techniques and post-operative care. A lot of my job is scrubbing in and understanding different complex procedures. So preempting what my surgeon needs from me with the instruments, passing them, the use and maintenance of specialised instruments and equipment. Examples of these may be the vessel sealing devices, possibly the neurology aspirators, to name a few, and also possibly arthroscope towers and the insufflators for laparoscopic procedures. Wound management, knowledge of advanced wound care and bandaging techniques, monitoring wound healing, assessing and choosing appropriate dressings. Again, a lot of the time we will discuss this with the relevant surgeon or veterinarian about this looks like this, would you be happy if we did this? And a lot of the time they would agree with us. Moving on to critical care and emergency response. So nursing high risk and complex cases that may need intensive interventions such as oxygen therapy. They may be induced under anaesthesia and placed on a ventilator. The use of more complex medical protocols such as blood transfusions. Intensive monitoring. So you may be sat with a patient around the clock, dependent on what is required. Triaging patients and knowing when intervention is required. This may be patients that are referred to you out of hours, or they may have come through a different department and they've decided it's better that they are triaged with you, and then reporting to the relevant member of staff about your findings and what may be required. Moving on, so the emergency care of the ability to handle emergency cases, perform CPR and assist with critical care, such as in the intensive care unit, ventilator support and fluid therapy. So communication skills. As I have stated before, you are working with a wide range of staff members, not just there will be more staff, but there will be more roles. So client communication, the ability to explain complex medical situations to pet owners in an understandable and empathetic way, especially during challenging or emotional times. A lot of the time, a lot of patients that come through to us are very sick, obviously because we are a referral environment. So they tend to be a bit more sicker than just your general wellness exams. It may be that it's a chronic problem that's been going on for a long time, and sometimes clients can become frustrated because of how long it has taken to get a referral, or things are not progressing, or things are not improving. So being able to come across in an empathetic way, especially during these challenging times, is a very important skill to have. Team collaboration. You must work effectively with veterinary specialists. So your residents, your senior surgeons, your interns, and other veterinary nurses across the other departments in a team environment. At the end of the day, we all work within the same hospital. So I know at Langford, we tend to obviously be very kind of flexible with where we'll go. So for instance, if it was quiet in theatre, but really busy over in Canine Med, I might be required to go over and help support them. Clinical decision making. Obviously, it is not your job as a veterinary nurse to diagnose. But the ability to quickly and accurately assess situations, anticipate potential complications, and make decisions based on the patient's condition, being able to pass this information onto the veterinary surgeons, and being able to have a kind of collaborative approach of discussing, for instance, this patient isn't eating, it hasn't been eating for 3 days. Do you feel that maybe a feeding tube might be relevant now? It is not your job, obviously, to make those clinical decisions and diagnose, but it is your job to advocate for your patients and discuss with the veterinary surgeons, obviously, what you feel may be best. On another note, on a less kind of intense note, it may be, they like chicken. I've noticed they like eating chicken more, so maybe you'll feed them chicken more, or they seem quite bored within their kennel. A lot of the time, the patients obviously shouldn't be jumping up and running around within their kennel. They should be quite settled because we're trying to get them better. But sometimes they just need a little bit more TLC, a bit more attention, and it's your job to obviously make those decisions to benefit your patient. And adaptability, the ability to handle unexpected changes in patients' condition and adjust their care accordingly. Leadership and mentoring. So within Langford's hospital, we are partnered with University of Bristol's veterinary medicine program, as well as their veterinary nursing program. So we do a lot of teaching and training of the students in our relevant areas. We may also help support interns and residents, again, in our specialised area. You may be required to train less experienced members of staff and take on a leadership role within the practice. Professional development, so there tends to be a more in-depth and structured development plans for upskilling and maintaining those skills and developing new skills. Continued education, there seems to be more access to continued education. This can be through obviously talks and lectures delivered by our diplomats, or this may be delivered by the residents or the interns in an area they're interested in, and then structured CPD. So within Langford, they obviously run additional kind of courses for members of the veterinary profession. So this may be the nursing internship, as well as the veterinary nursing residency program. So moving on to adapting to the new working environment. So new challenges and new opportunities. While the transition can be challenging, it's also an incredible opportunity to deepen your clinical knowledge and become more confident in various specialities, or even one speciality that you're very passionate about. You'll be exposed to cutting-edge treatments of new medical advancements that can accelerate your professional growth. I know personally I've developed a lot in the last year that I've worked at Langford in my area. And I definitely would recommend, if you have a passion for an area, to definitely consider working within a referral environment. But also, even if you haven't got one area that you want to specialise in, there are rotating jobs. At Langford, we have ninja nurses who rotate around the different departments, so they get to be exposed to all the different referral departments, but also they they haven't chosen one area, so they get a bit of everything. So it's important to being open to learning. It's likely that you'll encounter new procedures, diagnostic techniques, and terminology that you might not be familiar with. Don't be afraid to ask questions and seek guidance. I know I will cover it a bit later on, but I know that a lot of people within the profession have imposter syndrome, but also it can be extremely overwhelming in a large environment. No matter how long you've been qualified, whether you've been qualified for a year or 10. It's important to remember that learning is continuous and there's always opportunity to improve. That goes for every single member of staff that you'll encounter. They all started at one place, similar to you, and they have obviously developed over time. So it's important to stay organised, so managing records and treatment plans and patient histories are even more critical and may vary more case by case. So there may be certain things that you do which are more tailored towards that patient. There may be more protocols that you have to follow before you can have a patient. For instance, in my experience, there are certain things you don't just take the dog out, give it its induction agent, and then clip and take it in. There's a much longer process, which obviously means that there's more areas there's more time to ensure that things are done correctly and to gold standard. So the pacing and workflow within a referral practice, it's often more time consuming and intense, your case by case. So it is incredibly intense. I would be lying if I said it was easy, but it's so much, I found it so rewarding working within a referral environment. Then teamwork and collaboration. Again, while in a general practice, you may have been part of a smaller, tight-knit team. In referral practice, you'll be working with staff with varying expertise and experience. Like I said, you are going from students all the way up to, well-renowned specialists in their area. It's essential to build strong working relationships and recognise the value that each team member brings to the table. As I often try and remember, no person's experience is the same as yours. No person has exactly the same skill set as you. And it's important to remember to draw on those experiences. So that concludes part 2. Join me for the third and final part in our series of specialising, stepping into specialisation. Don't forget to like and subscribe, and please feel free to view our other Langford Academy nursing videos.